Hi there, my name is Amanda Montana and I'm a current fourth year student at the University of Toronto, and I'm just finishing up my studies in human biology, physiology, and immunology. And for the past year, I've been working in the Dr. O'Connor lab at Sick Kids Hospital. This poster presents data from one of the outcomes of my larger systematic review exploring the relationships between maternal weight status and onset to lactogenesis 2, produced milk volumes, and infant milk consumption. So here I have just reported the results regarding the onset to lactogenesis 2 outcome. Early cessation of human milk feeding is common, and it often reflects maternal perceptions of low milk volume. Maternal body weight may influence human milk production, including the timing of lactogenesis 2. However, this relationship is not fully understood. Lactogenesis 2 refers to the onset of larger amounts of milk, or in other words, when a mother's milk has fully come in. The overall objective of my study was to explore the association between maternal weight status and onset of lactogenesis 2. We conducted a meta-analysis to compare the relative risk of delayed lactogenesis 2 in mothers with underweight versus normal weight versus overweight and obesity. We also conducted a random effects meta-regression to explore the associations between maternal BMI and hours to onset of lactogenesis 2. We've included 17 articles in our analysis. Our meta-analysis results showed that mothers with an underweight status and a normal weight status were less likely to experience delayed onset of lactogenesis 2 compared to mothers with an overweight or obese status. As well, mothers with an underweight status had a lower risk of delayed onset of lactogenesis 2 in comparison to those with a normal weight status. Our meta-regression results showed a positive but not statistically significant association between maternal BMI and hours to onset of lactogenesis 2. This systematic review and meta-analysis is the first to explore the associations between maternal BMI and onset to lactogenesis 2. Although it did not reach statistical significance, our meta-regression found a positive association between maternal BMI and hours to onset of lactogenesis 2. Specifically, as BMI increased by 1, onset to lactogenesis 2 increased by about 4 hours. While not statistically significant, the observed association is definitely clinically relevant because the difference accumulates to a 40-hour delay between a mother with a healthy BMI of 20 versus a mother with an overweight BMI of 30. We also found that mothers with overweight and obesity were at an overall higher risk of delayed onset of lactogenesis 2 compared to mothers with normal weight or underweight. Considering the risk of delayed lactogenesis 2, there is a need for more specialized lactation supports for mothers with overweight and obesity in the early postpartum stage to help prevent early cessation of human milk feeding.